Good day, everyone. My name is Dr. Dendema Kanjiola, and I'm taking you Introduction to Clinical Nutrition NUD222. The course content for this week is malnutrition, and under this topic, we'll be looking at meaning of malnutrition, types of malnutrition, causes, consequences, and prevention of both undernutrition and overnutrition. What is malnutrition? Malnutrition is the condition that develops when the body does not get the right amount of the nutrients it needs to maintain healthy tissues and organ function. When we talk about the right amount, we are talking about the quantity and also the quality. So, for the body to develop, the body must have nutrients in the right amount. And to, to a layman, malnutrition can be referred to as bad nutrition. Types of malnutrition. We have different types of malnutrition. The figure display above show different types of malnutrition. The first one on the far right, far left, is undernutrition, and that undernutrition have three forms: stunting, which is refers to low height for age. We have wasting, low weight for height; underweight, low weight for age. Number two types of malnutrition is overnutrition, situation when one eats in excess of what is required. And it has two forms: overweight or obesity, that is high weight for height. We also have diet related non-communicable diseases such as diabetes, stroke, heart attack, and cancer. And the third type of malnutrition is micronutrient related malnutrition. And these are in two forms: micronutrient deficiency, such as iron deficiency, iodine deficiency, and the zinc deficiency. They are form of micronutrient. And we also have micronutrient related malnutrition in excess, taking micronutrient in excess, such as sodium. Sodium, when we take sodium in excess, can result in hypertension. The pictures displayed above show different forms of malnutrition: acute malnutrition, which is due to short inadequate intake of nutrient for a short time. One is not having access to food for a short time, can result in acute malnutrition. And we have seen earlier, wasting is an example. And we have edema. You can see in the second child, the feet are swollen. That is what we call edema. We also have chronic malnutrition. That is when one is exposed to a long term adequate to food for a very long time. It can lead to chronic malnutrition. An example is stunting, when someone has a low height for his age. You can see the two children there, the two girls, they are of the same age. You see one is tall, one is shorter. The one that is shorter is suffering from chronic malnutrition. What are the common causes of undernutrition? Causes of malnutrition are divided into three. First is the basic causes, and these are may be due to social culture and the cultural belief. We know what we eat is governed by tradition, the economy, and the political context. The political will for government to institute intervention to make decisions that will benefit the people, economic program policy of the government, and this may lead to inadequate financial, human, physical, and social capital, which will affect how household access to adequate quantity and quality of resources. So resources such as land, education, employment, income, technology. All these are under basic courses. Then the second one is underlying courses. The underlying courses, we have three forms: household food insecurity, when a household have inadequate access to food throughout the season. We have inadequate care and feeding practices, unhealthy household environment, and inadequate health services. These are underlying causes. And the third main cause is inadequate dietary intake as well as dietary infection. Combination of inadequate dietary intake and infection lead to undernutrition. So these are the three classes of causes of undernutrition. What are the consequences of undernutrition? One, high child mortality, death, and disability. Newborns who are born small for their gestational age are more likely to die than children born at a healthy weight. A severely stunted child is 4 times more likely to die than a healthy child. A severely wasted child is 9 times more likely to die than a healthy child. Micronutrient deficiency, including vitamin A, zinc, and iron, impair the immune system, thereby increasing risk of illness and death. Anemia also increases risk of maternal and perinatal mortality. Vitamin A deficiency causes blindness. Children who are undernourished at birth, in infancy, and in young children, and who also gain weight rapidly after age 2 are at increased risk for disease in adulthood, including hypertension, cardiovascular disease, and blood glucose concentration. Number two, weakened brain development and nervous system. As a result of undernutrition, it may lead to impaired cognitive development, poor school achievement, absenteeism, which as a result of stunting, iron deficiency, anemia, iodine deficiency. We also have neural tube defect as a result of folic acid deficiency. We also have impaired fetal brain development, brain damage, severe mental retardation, or congenital abnormality, which is caused by iodine deficiency in pregnancy. Number third consequences in there is socioeconomic consequences. Undernutrition contribute to poverty because a sick person is not as productive as a healthy individual. It also increase cost of treating illness attributable to malnutrition. It also increase cost of caring for sick. And lastly, lost care for those children that are not sick in the household member. The parents, the mother or the father will not be available for them to take care of them. So these are consequences of undernutrition. Who are the greatest risk of undernutrition? We call them the vulnerable groups. Who are those vulnerable to undernutrition? One, infant and children from pregnancy to age 2, non-breastfed children, orphan and vulnerable children, women of childbearing age. They are all vulnerable to undernutrition. Pregnant and lactating women, people suffering from chronic or infectious diseases, and the elderly. Those are the greatest risks of undernutrition. Now the picture display above show the effect and the undernutrition across the life cycle. Let us take example of a child that's a low birth weight child. What is the effect of malnutrition? Can see it can lead to higher mortality rate, impaired mental development, and increased risk of other chronic diseases. This we have mentioned under the consequences. Now, if this baby, low birth weight baby, is further exposed to inadequate intake of feeding of food, frequent infection, inadequate food health and care, this child is the one that developed to a child that is stunted. And if this child that is stunted is not treated or does not have the right quality of food, right quality of health care, this child develop to adolescence that is stunted, and this further this one will reduce physical labor capacity of the individual, lower educational attainment. Those are the consequences. And if this adolescent stunted child is not taken care of, is not given the right food, the right medical care, it develops, is a female, they become pregnant and give birth to a low weight baby, and the cycle continues. This develop into a malnourished woman, and if she's pregnant, not given the right food, they give birth to low birth weight child. And if she's not pregnant and become older, she become a malnourished older individual. So it's so the cycle. So it's a generational, so we call it generational cycle effect of malnutrition. It can be generational. So what we need is to break the lanes. So what do we do to break this lane? How do we stop a low birth weight baby from developing into a stunted child? That leads us to the next subtopic: prevention of undernutrition. How do we prevent undernutrition? One, promotion of exclusive breastfeeding and continue breastfeeding up to 2 years and beyond. What is exclusive breastfeeding? Exclusive breastfeeding is feeding a baby with only breast milk for the first 6 months of life. No water is added. Then number two, appropriate complementary feeding practice. That is, at the age of 6, a child is introduced to food that is appropriate. And when we say that is appropriate, it must be appropriate in amount. It must be appropriate in texture. It must be varied diet, contain different types of diets. So call it the appropriate complementary feeding practice. 3. Supplementation with vitamin A and iron folic acid. Vitamin A boosts the immunity of the child and prevent the child from becoming sick all the time. The immunization and deworming, promotion of maternal nutrition, water, sanitation, and hygiene practices, and growth monitoring program. Those are ways of preventing undernutrition. Now let's look at the second aspect of malnutrition, which is overnutrition. What is overnutrition? Overnutrition is a condition caused by abnormal or excess fat accumulation in the body that may lead to health problems and reduce life expectancy. Overnutrition starts as overweight, and if left uncontrolled may progress to obesity. Obesity is the severe form of overnutrition associated with adverse health conditions. Causes of malnutrition: 1. Increased consumption of energy-dense food. Nutrient-poor food combined with reduced physical activities. When we are consuming food and we are not using it, we are sedentary in nature, we are not involved in every physical activities, may lead to overnutrition. The body keep on depositing the excess within the body, especially if it is carbohydrate or fat in nature. So the body keep on depositing it, not using it, and becoming fat. At the beginning, we think it's a sign of good life, but later we know it's a ticket to other problem. We have other causes include medications, metabolic syndrome, hypothyroidism, modern conveniences, and lifestyles. Yes, modern conveniences. Their technology have taken over things we can do physically. So our lifestyles, using lift instead of using the staircase. So there are modern conveniences. Then genetic factor or family history of obesity. We have somebody that has been obese along our family line, we are likely to become obese. Peer pressure, psychological factor, health condition, environmental factors. Consequences of overnutrition. Overnutrition, overweight, and obesity during pregnancy increase risk of childhood obesity, which in turn increases the risk of adolescent and adult obesity. What he's saying is that the mother, that if an obese mother give birth to a child, the child in later in life may become obese. Maternal obesity is associated with complication during delivery, gestational diabetes, preeclampsia, maternal death, and neonatal and infant death. Then number three, overweight increases the risk of chronic heart disease, type 2 diabetes, gut, and hypertension. Now let's look at the consequence of overnutrition and using obesity as an example. What are the other complications as a result of obesity? One, diabetes, heart disease, cancer, high blood pressure, sleep apnea, high cholesterol, hypertension, respiratory problem, quality of life reduced, and arthritis. These diseases comes along with obesity, and this is what we call obese syndrome. How do we prevent obesity? Overnutrition. Education and behavior change at individual and programmatic level. So we need to continue to educate people on a healthy diet, nutrition education and counseling on a healthy food choice, healthy eating habits, increase physical activity, control amount of food eating, improve sleep, reduce stress, routine nutrition assessment, counseling, and support. These are ways which we can prevent obesity. Thank you. To round up this season of the class, we'll be having group assignment. The class will be divided into four. Group A will look at how undernutrition can be prevented at individual level. Group 2 at household level. Group 3 at community level. Group 4 at national level. Thank you for listening. See you in the next class. Thank you.